Asymptomatic transmission is particularly leading many to institute severe lockdowns and policies requiring masks in public. That's because those patients never develop symptoms, or healthcare workers in many cases don't even know that they're infected. Healthcare workers, or HCWs, managing patients with COVID-19 have increased the risk to get infection through transmission. In addition to that, they're asymptomatic. They might transmit the infection to the patient itself. So to talk about this, it's a privilege to have with us the Director of Development Quality at Sultan Qaboos Hospital, who, among the many research projects of the COVID-19 program of the Ministry of Higher Education and Research and Innovation, explored a lot of cases of COVID-19 virus in hospital workspace, titled as Identification of Asymptomatic Carrier of SARS-CoV2 among healthcare workers. It's an honor to have with us right now the author, the researcher of this particular project, Dr. Amal Al Shibli. Doc, welcome to the program.
Thank you very much. Thank you. Thank you for highlighting this study and giving me a chance to share it with the audience and everyone. Thank you.
Okay, so nothing quite like the information coming from someone who's got firsthand experience in dealing with this kind of pandemic in the front lines to talk about this topic.
So actually, as you said, it is a concern. So once the pandemic started last year, a lot of issues raised up and a lot of information coming on daily basis. So the team actually thought, why we don't explore the asymptomatic healthcare workers. Mm-hmm. We were lucky to be funded by the Ministry of Health, Education, Research and Innovation. I would like to thank them for the funds. Mm-hmm. We thought initially to conduct this study in different hospitals, but later on we thought, why we don't concentrate on one hospital, and we approve it maybe in future. As a future plan, we will conduct it in more than one institute, or even we can make it as international or national at the national level. So we provide the idea, and luckily we get the funds, and our objectives were one, to find out what is the incidence of the asymptomatic carriers of COVID-19 among healthcare workers without they even acknowledgement, or even they are unaware of their status. Yeah. And the second objective was to describe the demographic, clinical, social features which is associated with this status, and if there is any way to prevent those. So we conduct the study on almost 583 participants from our healthcare workers at different levels, physicians, nurses, securities, administratives, and we divided actually our sample to include, or to have those who have a direct contact with patients who are diagnosed to have COVID-19 disease or infection, and the other category, those healthcare workers who have no direct contact, and see if there is a relationship between the infection status and the nature of the work. Research, you have to go with specific rules, specific steps. So after getting the funds, we prepare our proposal. We submit it to the for ethical approval, and then once we got the approval, we start the steps. So for the enrollment of the participants, we prepare announcement, internal announcements in both languages, of course, because you need to get everybody as much as you can. Once the participants agree, they have to sign a consent, and then they will fill out the study questionnaire to collect the data we are looking for, which is demographic, clinical, social information, which is actually known internationally, although we just modified a little bit based on what are we looking for. And actually, we modified especially the social information.
Yeah.
And then those candidates will go into the process of collecting the nasopharyngeal and throat swabs by well-trained research assistants, looking for the virus presence through whatever is known as RT-PCR. Okay? After we got the results, we have to be very careful now because we have to inform those who were positive and go with precautions and quarantine and so on, which actually shows that 4.1% of our healthcare workers were infected with COVID-19 virus without showing any symptoms. And surprisingly, because we already divided the group, we found that those who are in close contact with the COVID-19 patients are having less incidence compared to those who are not in contact or in direct contact with patients with COVID-19 patients. You can say almost 30% versus 70%, which is significant. Not only that, those who are actually with direct contact with COVID-19 patients are more cautious even outside. So because we elaborate more on the social information like attending social gathering, traveling among cities, and strict hand hygiene, masking, physical distances, and so on. So this group is actually having lesser incidents because they are more adherent to the precautions even outside the hospital. Which is likely that the community infection has played an important role, especially in the other group. And actually the 4.1%, which I mentioned initially, 25% of them develop minor symptoms later on within two weeks, from the day we took the swab, which was actually well known that those participants might have minor symptoms. And we find out that actually adherence to the infection control measures is very important, but also we need to monitor that and we need to control that. And here we can think about the importance of the infection control and prevention department, the quality department, because they have to keep eyes from the beginning on the healthcare workers and make sure to maintain such procedures.
Is there any difference in intensity for spread of COVID-19 between symptomatic carriers and symptomatic patients?
Symptomatic patients, definitely they have a higher chance of spreading the infection. But sometimes you can just think that they are infected, they will be more cautious or more careful compared to the asymptomatic carriers. So bottom line, everyone should be careful and cautious and take the prevention measures, assuming that he or she might be a source of infection.
All right. So how long is the survey, Doc?
We started maybe, I'll say, August and till February. So you can say maybe 6 months. 6 months duration,
So how many hospitals did you go to, actually?
We conducted only at SQH due to some logistic reasons. Initially, we thought to do it in a few hospitals inside Muscat, but later on, due to a few issues, we thought let us just do it at SQH, Sultan Qaboos University Hospital.
All right. So what is the significance of this study, especially for the healthcare workers?
So healthcare workers should be very clear and aware because there might be a potential to spread the infection. And it is very well known, even throughout different countries internationally, that the adherence of the healthcare workers to the infection prevention measures sometimes is not optimal. And especially if you are very busy, overwhelmed, you are in pandemic, you might be lax in adherence to those measures. Although strict adherence will not make the chance of transmission zero, but definitely it will minimize it. So they should be aware of this result and they have to be very careful and to prevent the transmission to their patients.
Okay. Should we focus on those people who are positive but asymptomatic?
25, I'll say we recruited 583.
Okay.
4.1% of them were positive with no symptoms. But 25% of those developed symptoms within 2 weeks from taking the sample or the swab. Okay, those symptoms actually were very minor, and luckily no one get admitted, nobody got severe infection.
How about running us through the logistics? You suggested that segregating physically areas and designated COVID-19 teams who are rarely interactive with the with non-COVID teams might be the reason why there's some kind of a low incidence here, right?
Because I'm sure it is the same measures taken in different institutions, locally and externally, actually. So to separate or to segregate the areas where you're going to take the care of suspected patients versus not suspected patients from the beginning once they arrive to the hospital throughout. So segregate the areas, segregate even the team looking for those patients, and try to minimize the interaction between them. So that will help definitely in minimizing the spread of infection, because at least you are having them in a combined area or a specific area, and you can trace them.
So what role does the community transmission play here in the overall scheme of things?
It is a major player. I can say it is a major player. This was actually supported by our study, as I mentioned. Those who are actually working with COVID patients or looking after COVID patients are more adherent to the infection control measures, whether they are in the hospital or the outside hospital. So this make an evidence, clear evidence, that community transmission is a major issue here, and that's why this group having less incidents and actually are more strict with their measures like masking, physical distancing, hand hygiene, and so on.
How many are you in this project, Doc?
So the team actually composed of almost eight researchers, I would say. Different level, different areas. We have a group from laboratory, we have a group from emergency department, we have some from, for example, infection control. So we are almost 8 researchers. Wow.
So it's a team effort, actually.
It is team effort, and I would like to thank them all for their great effort and help and support throughout this project, actually.
What to you is the greatest challenge in ending this pandemic and curbing its adverse impact on healthcare workers?
So we are almost 1.5 years in this pandemic, and I think we need to live with it. I think the best is to get the vaccination of 70% of the community, as is recommended by the experts. We are actually lucky as a front liners. So almost all the healthcare workers are already vaccinated.
Okay.
And however, because the community transmission play a major role, as I mentioned, we need to work on this and control the community transmission.
What are the sources of exposure in healthcare personnel with the coronavirus?
Because our studies show that the direct contact with those patients is not a clear evidence that they have a higher chance. We cannot say that the source is only in the hospital. And actually that the study proven the opposite. And I can say, because you know that you are in a risky area like hospital, and even higher than that, you are dealing with a COVID-19 diagnosed patient, you will be more and more cautious. And that's why you are seeing somebody who is suffering at front of you, and you don't want you yourself to be at that position. That's why you have to be very cautious inside and outside the hospital.
How would you motivate your fellow healthcare workers and the people of Oman to hurdle and live through this pandemic?
So we need to accept the fact that COVID-19 pandemic end date is not clear yet. And we need to live with it, as I mentioned.
Mm-hmm.
It became, unfortunately, our new norm. That's why our adherence to the prevention measures is very important, very crucial.
Mm-hmm.
Also, they should comply with whatever advice is given by the public health experts. It shows me that though we are in the pandemic, though we have to run the service, we still can conduct research, and this we need to do that because we need to answer a lot of questions which is going on. And I would like to thank everybody get involved in this study, even our participants. Without their involvement or without their participation, we will not reach to this. The team members who helped me, the Ministry of Higher Education, Research and Innovation who funded the project, the Deanship of Research at SQH, the administration of SQH also. So you can do it regardless of the challenges you will have.
So since COVID-19 infection ranges being symptomatic to multi-organ failure, healthcare workers managing patients with COVID-19 have increased risk to get the infection through transmission, and also the asymptomatic HCWs might transmit the infection to the patient. So the solution of segregation may be the answer to minimize the spread, according to Doc earlier. At present, the number of confirmed cases of COVID-19 continues to increase. Well, I hope that this will minimize as soon as possible. Thank you very much, Doc, for being here. It's a pleasure of having you. All the best and more success to you and your work research.
Thank you very much. And it was a pleasure to have this invitation, and thank you very much.
Okay, all the best. That's Director, Development and Quality, Sultan Qaboos Hospital, Dr. Amal Al Shibli, a research project of the COVID-19 research program of the Ministry of Higher Education, Research and Innovation, exploring cases of the COVID-19 virus in healthcare workers. I'm Frank. Thanks for listening.